Two cases of the newly identified variant of coronavirus have now been identified here in the United Kingdom. The World Health Organization says early evidence suggests the variant, named Omicron, poses an increased reinfection risk. The Health Secretary has been talking to reporters about this in the last few minutes.
Well, late last night I was contacted by the UK Health Security Agency. I was informed that they have detected two cases of this new variant, Omicron, in the United Kingdom. One in Chelmsford, the other in Nottingham. The two individuals concerned are self-isolating alongside their whole household, whilst further tests and sequencing is carried out and contact tracing. The two cases are linked. Now, we've been always very clear that we won't hesitate to take further action if that is what is required. And today I can announce one thing that we are doing immediately is carrying out targeted testing and sequencing of positive cases in the two areas that are affected. And secondly, we are adding 4 more countries to the red list from 4 a.m. on Sunday, and those are Angola, Mozambique, Malawi and Zambia. If anyone has travelled to these 4 countries or any of the other recently red-listed countries in the last 10 days, then they must self-isolate and take PCR tests. And also, later today, the Prime Minister will be holding a press conference with the Chief Scientific Advisor to the government and the Chief Medical Officer to set out further measures. And lastly, this is a real reminder to us all that this pandemic is far from over. And if there's one thing that everyone can be doing right now is, if they're eligible, please take your vaccine. Whether it's your first shot, your second shot or your booster jab, if you are eligible, please take your vaccine.
Are you concerned that this new variant is in the UK now?
Of course, we were concerned from the moment we first identified this new variant. As I've said before, it is a deeply concerning new variant and we do need to learn more about it. But the fact that we now have these 2 cases in the United Kingdom means that we do need to take further measures, and that's why I've just set this out today.
What impact will this have on the current vaccine and booster rollout?
Well, vaccines remain vitally important, and if anything, I think the importance of them, especially the booster vaccine, is now even more important. We know there's this new variant out there. We don't know enough about it yet, but from what we do know, that we know that the protections that we have, especially the vaccines, are hugely important.
Now that we have 2 cases, what discussions are you having about any potential plan B, any potential change in restrictions as we head into Christmas? How does this change things?
Well, we've always been really clear that we will do whatever is necessary to protect the progress that we have made as a country. We've come a long way, especially since the summer, and we keep all of this under review, and if we need to take further action, we will.
What can you tell us about the countries that the 2 people who have this variant, where have they been, where have they come from? What do you know about their movements? And do you expect to be able to contain it to the 2 individuals?
This particular case, as I say, these 2 cases we've identified are linked, and it has been traced to Southern Africa.
One final question. Are you concerned at this point, given what we know about this variant, that we will be looking at potential changes to the status quo at the moment as we run into Christmas? How should people view this, sitting at home, making their plans for Christmas, thinking everything was going to be all right? What can you tell them realistically about what you know about this variant, about what might lie ahead in the next few weeks?
Well, everything we know about this variant, our international partners know. We have been very, very open, and that's the right way, of course, to make people and help them to know why we are concerned. And I made a statement in Parliament yesterday to set out more of that information. But the one thing I would say again to anyone is that we've made a lot of progress. We all want to see that protected, and if anyone's sitting at home thinking, what can I do? Get vaccinated.
So that was the Health Secretary. Let's talk to our health correspondent, Catherine Da Costa, who's with me now. So 2 cases in the UK. What will scientists here be doing right now, do you think, on this?
So the sequencing and surveillance in the UK is actually really strong. We do about 20% sequencing of positive cases already, and they've been looking at this. They've identified 1 case in Chelmsford, one case in Nottingham, and they're saying that they're linked. And as you heard the Health Secretary say, they are carrying out targeted testing in those two areas. And the households involved are isolating at home. And one of the really important public health messages to get across is that people coming back from any of those southern African countries need to isolate at home for 10 days and take a PCR test. So on the ground, UK Health Security Agency will be closely monitoring this. We have PCR testing, which can actually spot this mutation because of what's called the S gene dropout. It's picked up in PCR testing. Now, that's not 100% accurate, but it's like an early heads up that this could be this new variant, and then that can be taken away for sequencing to get a confirmation. Clearly that's what's happened, and they've identified and confirmed these two cases. So then it's about really targeted surge testing and tracing, making sure you get in contact with those close contacts, getting them to isolate. They're wanting to put a lid on this because there is this concern about this particular new variant of concern. Because it's so highly mutated, there's a lot of mutations around the spike protein. That's the bit of the virus that it uses to break through into the body's cells. And if there's lots of changes, the worry is it might be more transmissible and that it might reduce some of the protection we get from vaccines. So there are some concerns, and the World Health Organization has said that there is some early evidence that might suggest that this variant increases the risk of reinfection and might be driving a wave of infections in South Africa. So there is concern among scientists there, but equally there's a lot we don't know. And these travel bans that we've talked about, and the Health Secretary is extending to more countries, Angola, Mozambique, Malawi and Zambia from 4 o'clock on Sunday morning, they are helping to delay the arrival. It won't stop it. As we've seen, we've already got 2 in the UK, but it buys some time because more research needs to be done in the lab and in the real world to understand how this variant responds so that scientists know how to act. Now, one of the most important things, as you heard from the Health Secretary, is vaccination. Having first and second doses plus the booster really tops up that protection. And that senior scientists are actually saying the vaccines are working really well, protecting against serious disease, against other variants. And so they are optimistic that they will still be effective against this new variant.
OK, Catherine, thank you very much. That's Catherine Da Costa, our health correspondent. And let's get the very latest from the World Health Organization. We can speak to Dr. Margaret Harris, who is spokesperson for the WHO. Thanks for being with us once again, Margaret. And how worried are you by this Omicron? We know it originated in Africa and flights have been stopped because of that, but it is now clearly in Europe as well.
Good afternoon, Ben. I think we can't even say it originated in Africa. What we do know was it was reported from Africa because the South African science is so very good, and not just so very good, but so very open. They reported very, very quickly. But we can't guarantee that it actually originated in Africa. Now, the reason we made it a variant of concern so quickly, 2 reasons. We got that information very quickly, but also because, and Catherine, I agree with everything she said, mentioned the spike mutations, the 32 spike mutations that is much more than we've seen before, and also the suggestions that it seems to be very transmissible. We don't know that yet, and we really need to get much more information as quickly as possible. And
as we try to get that information, we are in a sense playing for time as the scientists try to investigate it. That's why we've got all these travel restrictions imposed on southern African countries, not just by the UK but by other countries too. Does the WHO, the World Health Organization, agree with those travel restrictions that have been imposed?
So our emergency committee under the international health regulations basically put it in a way that asks the countries themselves to make the decisions based on their risk assessment and the science as we understand it. So it's a decision that's taken at national level. And indeed, if you do impose those restrictions, the aim is, just as Catherine said, to buy time, to get ready and get all the things going, like the enhanced surveillance, the sequencing, the plans about how you'll manage people when they come in to prevent transmission further into your community, and also how to manage your health system and look at backup and greater capacity and all those other things that you need to be planning to do.